Interestingly, the government of Uganda entered into advanced purchase agreements with the African Vaccine Acquisition Trust, known as Avat, of the African Union, and Covax, cost-sharing mechanism of Gavi, to purchase 9 million doses of the Johnson & Johnson vaccines and 2 million doses of the Sinopharm vaccines, respectively.
In the supplementary expenditure request of 208 billion by Ministry of Health, at least 8 billion is required to cater for allowances for COVID-19 staff, 11 billion to clear quota award to Sino Medicines, 6 billion to maintain oxygen plants, 2.7 billion for supervision of the International Specialized Hospital in Lubowa, and 3.6 billion funding for Busolwe Hospital.
Similarly, the Lubowa Super Specialized Hospital that we visited as a committee of health, and we made very strong recommendations. To date, Chair and honorable colleagues, we haven't gotten a status update on.
But most critically, the ministry requires at least 179 billion to clear a loan that was given for purchase of COVID-19 vaccines through Covax and Avat company.
Should provide clarification on whether funding to the UNICEF for purchase of COVID-19 vaccines was a grant or a loan to the government of Uganda.
Although the Ministry of Health had initially submitted 7 priorities to be catered for, Ministry of Finance only approved 5, while appearing before the Parliamentary Committee on Health. Officials from Ministry of Health, led by Dr. Jane Ruth Acheng, explained to the committee the urgency of the funds. The committee stood over the 11.5 billion meant to clear the quota award to Sino and 2.9 billion meant for supervision of the specialized hospital. According to the committee chairperson Charles Ayume, the ministry had more of misplaced priorities versus urgent priorities.
I really wonder what the 2.7 billion is going to be used for if the activity that has come out is just supervision, not doing anything.
Where is this money going? Is it coming directly to the Ministry of Health, or you have got a new supervisor? Are you the real supervisors anyway?
The committee instead proposed that 13 billion be allocated for rehabilitation of Mulago Hospital given the urgency, rather than payment of Sino loan and supervision of the White Elephant in Lubowa.
We're wondering why can't we give Mulago Hospital 13 billion shillings?
Members further questioned the 6 billion request for maintenance of obsolete oxygen plants, even after Parliament approved the budget for procurement of new plants.
The oxygen plants are recurrently being replaced, they're being broken down, and yet during the budget framework paper, we had okayed procurement for oxygen plants.
13 oxygen plants were procured because at that time there were 13 regional referral hospitals. Since then, Chair, these oxygen plants have done their work. During the COVID pandemic, they were actually overworked and were breaking down constantly.
Officials from the Ministry of Health will return to the committee tomorrow, Friday, to further defend their supplementary budget. Susan Naung and Gloria Guitabinji reporting for EBC TV.